I'm going to be presenting today on a middle-aged woman that I saw in clinic today. She came in with the chief complaints of headaches, anywhere from a 2 to an 8 in severity starting about 2 to 3 weeks ago. There was no identifiable temporal factor. She said they come and go whether she's working or not working. She does work as a computer data specialist, so I think that maybe the blue light from the computer could be contributing to these headaches. She's been trying to treat them with over-the-counter Tylenol and ibuprofen with some relief. She also finds relief from rest, but she says that due to her job and her stress level, she's not able to take rest very often. During my neurological assessment, cranial nerves 2 through 12 were intact. The patient was alert and oriented. I had her walk across the room and didn't see any irregularities or loss of balance in her gait. I listened to her heart. S1 and S2 were heard without any additional murmurs, and her lung fields were clear bilaterally on her front and on her back. I also took a look in her eyes. She had no sensitivity to light during my pupil assessment, and I didn't see any fluid or cerumen in her ears that could possibly be contributing to this. I think there could be a couple things going on. She didn't have any pertinent medical history, no diagnosis. She doesn't take any active prescription medications for any known diseases or disorders. She doesn't have any disabilities. I think that she might be having tension headaches just because of the band's-like quality. She said that it feels like someone's squeezing her head. She could also be having migraine headaches, or she could also be having cluster headaches. But if you look at the data, if she were to be having migraine headaches, she would have that sensitivity to light and sound. She might have other associated symptoms like nausea or potentially even vomiting, and she didn't have any of those things. Cluster headaches are a little bit more rare, and she did not have any facial swelling or any sort of tearing and other symptoms that are more closely associated with that. So I do think that tension headaches are what's going on here. I did have 2 questions for you. I wanted to know if you thought that any sort of imaging was indicated at this time. I would not want to expose the patient to any sort of unnecessary radiation, but it might be important to rule out some sort of tumor with a head CT. I also wanted to know if you think that she should be managed with some prescription medications or some sort of abortive medication such as sumatriptan at this time. My current plan for her was I don't think that I was going to prescribe her anything. I was going to tell her to continue to manage her headaches with over-the-counter ibuprofen and Tylenol. I was going to recommend Excedrin migraine because that has caffeine and Tylenol together, and she might find more relief from that. She could also use ice packs on her forehead to manage her headaches if that's something that's helpful for her. And I was going to tell her to make a headache diary with the frequency, the duration, so that way when she follows up with her primary care in about 4 weeks, she has a log of how many headaches she's having so they can kind of further assess and edit her plan. I was going to do some research tonight on some sort of preventative medications. If she still is having more than 8 headaches a month, we might want to look into some sort of preventative medication as opposed to treating them abortively like she's doing now. I know that there are some tricyclic antidepressants and other medications, this is topiramate and gabapentin, that can be used for that, and I'm going to do some more research on that later. Thank you.